Pulmonary embolism. What is a pulmonary embolism?
A pulmonary embolism is a lung disorder that is potentially life-threatening and we take very seriously. A clot usually is formed in veins in the lower extremities, like from the umbilicus down into the legs, and that clot will break off and move up the inferior vena cava to the right side of the heart and go out into the pulmonary artery and either flow into the right lung and left lung, and then as the blood vessels get smaller and smaller, will finally entrap that clot, and everything beyond that has a potential for dying. And that's a serious problem, and the patient will suddenly feel can't breathe, have a sudden pain, and they have to be taken care of promptly. But a clot to the lung is something that is very serious and we're very concerned about.
What are the most common signs of a pulmonary embolism?
The most common signs of a pulmonary embolism is the sudden onset of shortness of breath, dyspnea is the word, and it can also include a sudden stabbing pain in the lung, and that pain will persist and it will be worse with breathing, and the patient will take a breath, and if it includes death of part of the lung, the patient can start coughing up blood, and that's a very, very serious sign.
Who is at most risk for a pulmonary embolism?
There are a lot of people that are high risk for pulmonary embolism. If you sit on an airplane with the crowded seats that they have now, with seat belt across, and you sit there for 2 or 3 hours, and you develop poor circulation in your legs, the chances of clot forming in those veins because of the poor circulation goes up. If you lay in bed, patients who are chronically ill that will lay in bed for hour after hour, day after day, and then suddenly get up, go to the bathroom, they could jar loose a clot that is formed in their legs and suddenly experience shortness of breath and chest pain. Patients with congestive heart failure can develop pulmonary embolism. Unfortunately, young healthy women that are on birth control pills have a higher incidence of pulmonary embolism. There are certain congenital, there are certain genetic deformities within the bloodstream that will predispose you to forming clots. You can also find pulmonary embolisms will develop in patients who have occult or hidden cancers, especially in the abdomen. The first manifestation that you'll have, that a person may have a very hidden, small, early pancreatic cancer, for instance, would be a pulmonary embolism. So there's a lot of people that would come under the gun, if you will, as it relates to pulmonary embolism.
How is a pulmonary embolism diagnosed?
Pulmonary embolism can be diagnosed with what's called a VQ scan, which is a special kind of scan. You can do a pulmonary angiogram, which is a quite invasive procedure where you have to put a catheter into a vein, slide it on up into the right side of the heart, and then inject some dye into the pulmonary artery. As that dye goes out, it's dye that doesn't really color anything, but it's dye as far as the radiographic tube is concerned, and then it shows the outline of that clot. But the more preferred way these days is to do a very high-tech type of CT scan, the computerized tomography, and it's non-invasive, quite quickly done, and has become pretty much the gold standard these days of diagnosing pulmonary embolism. When you want to really make it difficult for medical students, you can ask them what is the most common finding on a chest x-ray, the plain early usual chest x-ray for pulmonary embolism, and the answer to that question is normal. So the normal chest x-ray can be seen frequently on the initial radiographic evaluation of pulmonary embolism. Most of the time students don't get that, so it's fun to ask that question.
How is a pulmonary embolism treated?
Pulmonary embolisms are treated now very effectively. We have many ways of treating them, to include heparin, which is a medication that's given subcutaneously, or it can be given IV, and it takes care of the initial problem of clotting, and then at the same time you start the patient on rat poison. Rat poison is Coumadin, warfarin, and it was initially developed as a rat poison, but soon came into the practice of medicine to make blood thinner so that clots won't form. So that initially you take care of the clots that are already there with the heparin and make sure that make sure that no further clots will break loose and go into the lung. And you run that for about 7 to 10 days roughly. In the meantime, it takes about a week or so for the Coumadin levels to build up so that the body is anticoagulated properly, so it won't coagulate the blood. Then you send the patient home for 3 to 4 months on the rat poison, on the Coumadin, and the rat poison or Coumadin has to be monitored carefully because there's a lot of things that can in your diet, certain medications that will either make the Coumadin less coagulating, or it can overcoagulate because of the medication or the food you're eating. So you have to track it fairly closely. What you're really doing is giving the patient a short-term course of medication that will give them hemophilia. You give them another disease to help correct this one disease, and then they come off of it. If they continue to throw clots into their lung, you may have to put a filter into the inferior vena cava that will take and filter out clots that will be coming up, but that's uncommon. Some patients who have clotting disorders that are permanent, they may have to take Coumadin for the rest of their lives, but that's unusual also.
What complications can result from a pulmonary embolism?
Pulmonary embolisms can cause the ultimate complication, and that's death. If untreated, a very large percentage will die. A second clot formed and then thrown on top of the first one can be frequently fatal. You can cough up blood. You can lose a lot of lung tissue that will become infarcted. That's the term used for cell death as a result of inadequate blood flow beyond where the clot came to lodge, so that there's a triangular shape of lung tissue beyond the clot that doesn't get proper nutrition, and it can then die. You can also develop pulmonary hypertension because the surface area of the capillary bed has been compromised and lessened because of the little clots that go in. The complications from pulmonary embolism, if treated properly, are uncommon. But when they do occur, they can be very, very uncomfortable and very difficult.
How can I prevent a pulmonary embolism?
The prevention of pulmonary embolisms, for the most part, is very simple. By getting up and walking around every 2 hours on the airplane is useful. If you're going to be in bed for a prolonged period of time, you can get what we call compression stockings that will allow the veins to be supported and will prevent the sludging of the blood and slowing down of blood flow out in the periphery of the veins. You can avoid medications that will develop blood clots, such as birth control pills. One of the common areas that we see pulmonary embolism forming from will be also patients who, for instance, the motocross bicycle riders that bang up their legs and get lots of trauma, horseback riders that hurt their legs and then get inflammation on the walls of the veins. These patients will have a higher rate of developing pulmonary embolisms also. If you can, avoid having those accidents, but I know that's difficult when you don't have complete control over a horse or any kind of activities that might cause injury to your lower extremities.